歡迎大家出席今日嘅記者。
Welcome to today's press briefing. We have with us two doctors on the stage, Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of Hospital Authority. Dr. Zhang will give us an update. Good afternoon. As of last night, we recorded 291 directly confirmed PCR tests, including 52 reported by the Hospital Authority, 44 reported by the Public Health Laboratory Service of CHP, and 195 reported by private laboratories. Also, for RAT positive results successfully logged on our online platform, we recorded 381 cases. Altogether, we recorded 674 positive cases. Cumulatively, we have recorded 1.204879 million cases in the fifth wave. And among them, there are 59 imported cases, 27 of them being picked up at the airport, 19 cases arriving on the 9th of June via 10 flights, and also 8 other cases arriving in Hong Kong on the 8th of June via 3 flights. 25 cases have been picked up in isolation or quarantine facilities, and 7 other cases picked up 7 days after the end of the quarantine period or in the community. There are 4 cases with higher CT values. We believe them to be repositive cases. There are also 3 other cases with lower CT values. It is possible that they are local cases because they have had activities in the community. As for residential care homes, we have not logged new cases. For schools, we received 106 reports of positive cases from 93 schools, including 84 students and 22 teaching staff. For the 84 students, they are from 14 kindergartens, 40 primary schools, 29 secondary schools, and 1 special school. For the 22 teaching staff, they come from 9 kindergartens, 5 primary schools, and 8 secondary schools. In the past 7 days, 32 schools recorded 2 or more than 2 positive cases in the past 7 days. And we will check the situation of these schools, and we have found them to be sporadic cases occurring in different classes and forms. They may have to do with increased activities in the community. As for today's cases in Polang Kok Lam Chan English Primary School, yesterday we recorded 1 teacher and 3 students in class 6A being positive. Now for that class, we have advised them to suspend face-to-face class teaching at the moment, and today we recorded 3 other cases in class 4B, and again we have advised suspension of face-to-face lessons for 4B. As for international section of Kiangsu and Chekiang Primary School, P5 have suspended class face-to-face lesson, and we understand 1 more teacher tested positive. And for Samyi Tinde Kindergarten in Chun Wan, the PN1 class, morning class, has 13 students, and 2 teachers and 2 students test positive, and we've already advised the kindergarten to suspend the classes for a week. And for Bak Ho Lei, a school in Wan Chai, there are 5 students in 5S being infected, and we have recommended suspension as well. As for a number of death cases, we have not recorded new death cases. So the total death count, as reported yesterday, remains the same. For BA.4 imported cases, as of today, we have recorded 24. For BA.5 imported cases, we have recorded 40. For BA.2.12.1 Omicron cases, we recorded 128 imported cases and 16 local cases. That is BA.2.12.1, and today we have also recorded 11 other cases suspected to carry BA.2.12.1 substrain, and 4 of these cases may be related to the previous cases. Among them, we recorded a 10-year-old boy whose family member was a confirmed case, and he lives in Homentin 1, and also another 40-year-old male living in Poyang Mansion, and a family member has been a confirmed case, and during the quarantine period, this man becomes a confirmed case. Another couple living in Cheung Kwan O Warming Court Warfai House, one aged the man aged 84 and the female aged 86. They were previously subject to compulsory testing notice, and they live in another unit. As for other cases, no linkage has been identified at the moment. We have a 49-year-old male living in Tower 12 of Ocean Shores, and also a 3-person household living in Hang Shun Court of Tuen Mun Castle Peak Road, and a 47-year-old living in Tuen Mun Center Mansion, and a 68-year-old female living in Segment House of Homentin Estate. During the RTD operation, this case was picked up, but we understand that according to preliminary gene sequencing analysis, other cases occurring in the same building may not relate to this case. Those cases are BA.2.12.2 and another 33-year-old female living in Kowa Mansion in Wan Chai. For bar clusters, there are 3 new cases for Shuffle. Altogether, 107 patrons and 6 staffers have been infected. That concludes my report. Dr. Lau will give you an update on HA situation. Good afternoon. At the moment, we have 374 confirmed patients in our hospital system. 54 are newly confirmed cases. Among those in isolation facilities, 93 of them are in isolation wards, 7 in second-tier isolation wards, and 43 in North Lantau Hospital, Hong Kong Infectious Control Center. And among them, 31 are new cases. Yesterday, we did not receive any new critical or serious cases. And for confirmed cases, in hospital, we have 12 in critical condition and 6 in serious condition. 3 are receiving intensive care treatment at the moment. We did not record any death case yesterday. 54 patients recovered as of yesterday, including 42 patients who have been discharged. And in the 5th wave so far, 50,752 patients had recovered, including 50,371 who have been discharged. And since early 2022, 63,120 patients have recovered, including 62,751 who have been discharged. And 1 patient has been picked up via hospital admission screening, and 3 patients in the same ward have been regarded as close contacts. As for our staff, so far 23,633 staff have been infected, and 23,500 of them have recovered and returned to their position. The floor is now open. Please use the mic when you speak and introduce the media organization you represent.
Now TV.
Good afternoon from Now TV. So there are 291 PCR cases, and 381 of them have already been confirmed through have been confirmed RT cases. So altogether, there are 672 cases. So are there any cases that have not yet been confirmed with PCR tests? Yesterday, there are 2 recovered patients who were once again confirmed within 3 months. So for those who have been vaccinated and recovered, do they have to be inoculated once again within 6 months of recovery? Well, today we have seen an increase of 668 cases, including both PCR tests and confirmed RAT cases. So that is similar to the total number of 672 cases today. The two patients we mentioned yesterday, one was a suspected of reinfection and another we believe it's reinfection through genome sequencing. However, there are over 1 million cases and we only identified 2 of them with reinfection. We have to see how many jabs they have taken. The first patient has been double jabbed and has been infected twice, and in accordance with our regulations right now, they do not need to take another jab. As for the other person, he was tested positive through RAT the first time, and this time it is a PCR tested positive. So this person has only been infected twice, and this person might need to be vaccinated with doctor's advice. The lady over there. Good afternoon. From Hong Kong 01. How many RAT cases announced today have not yet been announced before, and there have been people who have visited Link, Shuffle, and Iron Fairies, all 3 bars, and that the genome sequencing are pretty similar. How many patients have been to all these 3 bars? Do you have the exact days and times when they visited the bars? Which bar do you think would be the origin of transmission? Well, for Link and Shuffle, are you still counting the numbers of infected cases from there? There are 291 PCR confirmed cases and also 381 which have been confirmed positive through RAT. So today there are 377 new cases. So the 377 have not been announced previously. And for some individual patients, they have been to Iron Fairies and Shuffle. There's one person who has visited Iron Fairies and Shuffles. There are 2 who have been to Iron Fairies and Link, and 1 who has visited Link and Shuffle. The genome sequencing found in these 3 bars are pretty similar, so there may have been some sort of transmission between them. But the cases we saw first was from Iron Fairy, so that may actually be transmission from Iron Fairies to Link and Shuffle. Good afternoon, Cable TV. I'd like to ask about the Joyful World Kindergarten. There are 2 in Tsuen Wan. Is it from the Lai Sing or the Tsuen King one? Yesterday, the suspected infected BA.4 and BA.5 person, the worker in the hotel from the Regala Sky City Hotel, do you know the source of infection? And we still see a tally of 600 odd cases each day. So would you consider tightening the social distancing measures? I'm sorry, I don't know that there are 2 Joyful World Kindergartens in Tsuen Wan. I would need to go back and check on the exact address. For the BA.5 case, at this moment, we do not see which case it is connected to because there are some cases from the hotel, and we may need to take a look at the genome sequencing because some of them were confirmed through RAT only. The lady in white. Good afternoon from Ming Pao. I'd like to ask about the part-time worker at Regala Sky City Hotel. So do you know which subvariant she carries? And how many close contacts are there? And she has been out to eat at a restaurant. So how many people did she eat with? And are they infected? For the class 5A and 4B in Poland Kok Lemon Chan English Primary School, are there classes or classrooms on the same floor? And for the 2 new cases in Warfai House, are those units facing the same direction? Yesterday, Dr. Chuang mentioned that there are about 900 people who have been infected previously in the 4th wave. Do you think that the reinfection cases are similar? Or do they suffer from similar symptoms? We are not yet sure whether she carries the BA.5 or the BA.4 subvariant. We need some time to do the genome sequencing. So we do not see any new cases from Regala Sky City yet. Those who ate with her have already been sent to quarantine. You asked about the Warfai House. Those are actually from different units on different floors. For the Lemon Chan English Primary School, we have to see whether they have been with each other. We are not sure whether they have any activities together. For those who have been infected in the 1st to 4th wave and now been reinfected in the 5th wave, I do not have information on hand right now. The last question, lady in the back. Good afternoon, Orange News. I'd like to ask about the variant. So we now have 11 cases with subvariants. So do you see an outbreak in the community right now? Is it difficult to identify all the transmission chains? The Hong Kong real-time effective reproductive number seems to be 1.7 today. How does CHP view the current situation? Would there be an outbreak in the near future? First of all, on BA.2.12.1, so the earlier cases were in Wan Chai and Tai Kuching, and now they have spread to other areas such as Tuen Mun, Sha Tin, Fo Tan, Cheung Kwan O, Ho Man Tin, and all these cases, other than a small number that are connected to previous cases, we do not yet see a clear connection. So it might be silent transmission in the community. Fortunately, many of the cases are asymptomatic, so they're basically the same as other Omicron cases, and we do not see serious conditions or deaths. I'm sure that for those who are vaccinated, it's very effective to prevent serious conditions or deaths against BA.2.12.2, BA.2.2. We see a surge of numbers in the last couple of days. Previously, it was around 200, 300, and now it's 500, 600. And we can see this reflected in the compulsory testing orders and also the sewage testing. We would continue to monitor the situation and to monitor the capacity of HA to see whether there are any deaths or serious cases. we believe there would be more transmission in the community, and we expect to see an increase in the number of cases. But then we are still going to look into any cases of outbreak, say for restaurants or bars. If we see large gatherings, then we would suspend their operations and then request them to conduct a deep cleaning and to see whether outbreaks could have been prevented.
As for schools, likewise, they need to guard against transmission as well. So we do require daily RAT to be conducted for teachers as well as for students. And this is an effective measure to prevent major outbreaks in schools. We understand that Omicron is highly transmissible. So when we see one or two or three cases in the same class, we would ask for immediate suspension so as to prevent major outbreaks. By doing so, we hope to slow down the surge in the number of cases. That's the end of today's press briefing. The speaker's not using a mic. The speaker's not coming through. No. There are 4 cases which we might have mentioned before, and they only recently had their RAT results confirmed.